How have breast cancer mastectomy techniques evolved? Imagine a time when removing an entire breast was the only way to fight breast cancer. Over the years, surgical techniques have changed dramatically, becoming less invasive and more focused on preserving quality of life. It all started in the late 1800s with the radical mastectomy, developed by William Stewart Halsted in 1882. This procedure involved removing the whole breast, the underlying chest muscles, and nearby lymph nodes. It was a very extensive surgery aimed at controlling the disease but often left women with significant disfigurement and physical challenges. Despite its widespread use for nearly 100 years, research showed that this aggressive approach did not always improve long-term survival for many patients. As surgeons learned more about breast cancer, they began to develop less radical options. In the mid-1900s, the modified radical mastectomy emerged. Surgeons like David Patey and John Madden kept the removal of the breast and lymph nodes but spared the chest muscles. This approach reduced physical trauma without sacrificing cancer control, making it a new standard for many cases. Around the same time, simple mastectomy combined with radiotherapy was explored, showing similar survival rates and offering women more options. The biggest shift came in the 1960s and 1970s, when studies demonstrated that removing only the tumor and a small margin of healthy tissue, known as breast-conserving surgery, could be just as effective as removing the entire breast. This meant women could keep most of their breast tissue, which was a huge step toward preserving body image and comfort. These procedures, called lumpectomy or quadrantectomy, are now common for early-stage breast cancer. In recent years, surgical techniques have continued to improve. Skin-sparing and nipple-areola-sparing mastectomies allow surgeons to remove the cancer while keeping more of the natural breast skin and nipple, making reconstruction easier and results more natural. Sentinel lymph node biopsy is now standard practice, where only the first few lymph nodes that drain the breast are removed, reducing the risk of lymphedema. Oncoplastic surgery combines cancer removal with plastic surgery techniques to shape the breast and improve appearance after surgery. Advances in breast reconstruction have also made a big difference. Options include using the patient's own tissue, like the tram flap or latissimus dorsi flap, or implants. These options help women regain their appearance and confidence after surgery. More recently, robotic-assisted mastectomies are being explored to make the procedure even less invasive, though these are still being studied for safety and cost. Today, the choice of mastectomy technique depends on many factors, including the size and location of the tumor, genetic risk, patient preferences, and available reconstruction options. The trend is toward less extensive surgery when it is safe to do so, combined with other treatments like radiation and systemic therapies. This evolution reflects a better understanding that breast cancer is often a systemic disease, and that less aggressive surgery can still effectively treat the cancer while improving quality of life. Always remember, each person's situation is unique, so it's important to discuss options thoroughly with healthcare professionals to find the best approach for individual needs.